Benjamin Franklin is quoted as saying, "An ounce of prevention is worth a pound of cure." Osteoporosis International explains that osteoporosis is the most common bone disease, and it affects about 20% of women and 7% of men who are over the age of 50. Half of them suffer an osteoporotic fracture, which results in physical and emotional consequences for the patient and places a major economic burden on the healthcare systems. Educating patients can help to improve osteoporosis prevention and treatment results. According to the Annals of Internal Medicine, risk factors for osteoporotic fractures include increasing age, being female, postmenopause for women, low body weight, hypogonadism, rheumatoid arthritis, being a smoker, low bone density, vitamin D deficiency, and low calcium intake. Long-term use of certain medications can also cause osteoporosis. The National Osteoporosis Foundation says that osteoporosis is a bone disease that occurs when the body loses too much bone or doesn't make enough bone. Osteoporosis means porous bone, and when the affected bone is viewed under a microscope, the holes and spaces are much larger than in healthy bone. This image shows the difference between healthy bone and porous bone. As you can see, the difference is quite dramatic. These bones have lost density or mass and contain abnormal tissue structure. Bones that are less dense weaken and are more likely to break. Broken bones are a serious complication of osteoporosis. Bone breaks caused by osteoporosis most commonly occur in the hip, spine, or wrist, but can occur in other bones. Osteoporosis causes permanent pain and can even cause a loss in height. When vertebrae or bones in the spine are affected, it can lead to a hunched posture. Patients who have osteoporosis may have limited mobility and may require long-term nursing home care. 20% of seniors who break a hip ultimately die within 1 year because of complications from the broken bone or the surgery required to repair it. Since you can't feel your bones weakening, osteoporosis is considered a silent disease. Often you don't realize you have it until you break a bone, you notice a loss in height or a forward curve in your upper back. Osteoporosis is far more common in older people, but it can affect younger people too. Young women who don't have regular periods may have low estrogen levels, which can cause osteoporosis. These irregular periods may be caused by exercising too much or eating too little, which causes you to become too thin. The good news is there are things you can do to prevent osteoporosis. An article in Physical Therapy says that physical activity is one of the most effective tools to combat aging. Not only do physically active older adults have a lower risk of developing coronary heart disease, strokes, hypertension, depression, dementia, and some cancers, exercise can also improve muscle strength, bone density, flexibility, and balance, which can decrease the risk of falling and fracturing a bone. Weight-bearing exercise helps to prevent and treat osteoporosis. Personal nutrition explains that even though there is no cure for osteoporosis, you can minimize your risk. When you're young, osteoblasts, the cells that build bone, are more active than osteoclasts, which dissolve bone. As you age, osteoblasts become less active as the osteoclasts continue to work. Here's an image of osteoclasts going to work and dissolving bone. This causes a decline in bone tissue and strength. Since men have a higher bone density than women, they have a lower rate of age-related bone loss. When women go through menopause, their estrogen levels drop, and estrogen is responsible for improving calcium absorption from the intestines while reducing its excretion from the kidneys. The final piece to helping prevent osteoporosis is to consume calcium-rich foods or take calcium supplements. Different age groups require different amounts of calcium, so be sure you are consuming the right amount. If you do find yourself with osteoporosis, there are FDA-approved drugs that help to conserve bone. Calcitonin and parathyroid hormone also are available to treat osteoporosis. These drugs work to slow bone loss by allowing bones to slowly rebuild and increase bone density, which can reduce the risk of fractures by 50% or more. These treatments should be accompanied with the regular recommended intakes of calcium and vitamin D, as well as regular weight-bearing exercises. By knowing the risk factors of osteoporosis early, you can take steps to prevent it before it happens by exercising regularly and getting enough calcium in your diet. If you do wind up with osteoporosis, it's not too late to start treating it with an appropriate drug to prevent further damage while continuing to exercise and consume adequate amounts of calcium for your age. As the saying goes, you've got to use it or lose it. Thank you.